Ask the Expert, brought to you by CommonSpirit Health.
We are asking the expert here with CommonSpirit Health. I'm with Dr. Jeff Pence, and we are talking about back pain, which so many people deal with. Jeff, you have something called a spinal cord stimulator, and that's what you're holding right here. Can you tell us what it is?
Yeah, so this is one of my favorite procedures we do for people that have not just chronic back pain, but any pain throughout their body.
Okay.
But, really well established for back pain. It's been around for about 60 years.
Wow.
Okay, so let's talk a little bit about why we have pain, right? So there can be a lot of different things that cause pain, but one thing that all pain has in common is they're going to travel through nerves, right, to the spinal cord and then up the spinal cord to the brain, right? Our brain's what interprets pain, so ouch, that hurts. And so when people take medications, they're essentially just throwing chemicals at that pain signal, trying to get that pain to go away or be less, right? So the way a spinal cord stimulator works is it uses electrical signals to interrupt that pain signal.
Wow.
So this is a little model of it. So you can see there's a little battery, okay? So this is what powers the device. And then it's hooked up to these little wires. We call them leads, but they're essentially just really thin wires. And so we insert them on the back side of the spine. So as these pain signals come to the spinal cord, it's delivering an electrical signal that's wiping out that pain signal or making it less.
Okay, which is the ultimate goal. What are the benefits of having this?
So there's a lot of cool benefits to this. Like I mentioned, this is one of my favorite therapies, and one of the reasons why is this is one of the therapies people will consistently come back and say that it's changed their life, right?
That's so good to hear.
They're always asking, why hasn't someone talked to me about this before? They've maybe had injections or ablations that have helped to some extent, but this is actually getting people back to doing things they want to do. Right? I'll share a quick experience. I have a patient, when he came in, he's had, back fusion, other surgeries, he's had lots of injections, he's on a lot of medications, and all he wanted to do was to be able to go to a movie or a Broadway play with his family, right? That's all he wanted, and he just can't do it because he can't go sit for 2 or 3 hours. So we did this, and now every time I see him, that's all we talk about. What's the most recent play you've been to? What's the most recent movie? And it's totally just changed his life.
I mean, these simple things that we want to be able to do in our life that are a big deal that now we can. What does it look like to sign up to get this in long-term management?
Yeah, so you have your initial consultation, right? We want to make sure that we think it's a good therapy for you. Something that's really cool about this therapy is, unlike a lot of things, you actually get to try this before you have it, right? So when I introduce this to a lot of people, they're a lot of times freaked out, right? I don't want to have that device implanted in my body. That kind of sounds scary, but really cool about this is you get to try it before you implant it. So there's a trial period. So for the trial, we actually will just put the leads, the wires in, just through a needle poke, and the leads will actually come out of your skin, and we'll hook them up to an external battery. And so you get to wear it around for a week and decide if it's the right therapy for you and that you love it. And then you come back to clinic, we just pull those leads out, and if you're like, holy cow, that I'm sleeping better, I was able to go to a movie, it changed my life, I'm using less medications, then we can go in and put it in permanently. So that's something that's really unique to this. I don't know a lot of other procedures or surgeries you get to try.
That you could try just to see if it works. Doctor, that's amazing. Does insurance usually cover this? Because I know people are thinking of that.
Yeah, great question. So like I said, this has been around for 60 years and has excellent insurance coverage, right? And we're always going to get pre-authorization to make sure, but yeah, it's well covered by insurance.
We love to hear that.
Yeah.
Amazing. Okay, thank you so much for answering all our questions. This is such a great option for people that live pain-free, which is what they want. If you want more information, you can head to the website on your screen. Doctor, thank you so much.
Yeah, thank you.